for your patience. So the purpose of this presentation is to explain so that everyone understands what exactly mental health means. I hope that you would learn how to improve your mental well-being as men, and also how to have you understand stress and how to manage it. I'll use this outline to explain. I'll start by explaining to you what, sorry, let's start this over here. Explain to you what mental health is from the right to the left. Then I will talk about statistics, men and mental health, and factors that influence a man's mental health and how to promote your mental well-being as a man. Then we'll go to the second part of this presentation, which is what stress is, how to handle it, and the causes and consequences of stress. So what is mental health? We use the word very, laxly. Mental health basically means, according to the WHO, it's a state of well-being in which an individual realizes his or her abilities, can cope with the normal stresses of life, and can work productively and fruitfully in such a way as to make a contribution to his or her community. So what this means is you realize your abilities in terms of your emotions and thoughts about yourself. You're able to handle external stresses of life. So mental well-being is not a lack of stress, it's being able to handle it in such a way that you are content and feeling competent in yourself and can work productively and fruitfully in such a way that you contribute positively to your community. Mental health consists of your psychological health, your thoughts, emotional health, your feelings, and social health, how you relate to people around you. So your thoughts affect how you feel, and how you feel affects how you behave. And how you behave is crucial because that is how you relate with everyone around you, your bosses, your family members. I want you to take away from this slide that mental health is equally as important as physical health. That's why I have the scale on the right-hand side there. There's a tendency for us to feel like physical health has an edge over mental health, but that's not true. As you shall come to see, mental health is very important. So what are the statistics? Generally speaking, men and women present with mental health disorders, but when it comes to depression, the male-female ratio is 1:2. So depression is not the same as sadness. You can be sad and not depressed. For you to meet criteria for depression, it means that you've had low mood, loss of interest, on most days of the week for about 2 weeks at least, in addition to loss of interest, loss of concentration, feeling like you're worthless, feeling guilty, may affect your appetite, and all those things, while sadness, is just low mood associated with your particular situation. So male-female ratio in depression is 1:2. What that means is that a female is more likely to be depressed than a man. For anxiety disorders, the same is the case. Men are protected from anxiety by testosterone, so it's a good thing. But when it comes to attention deficit hyperactivity disorder, men have this more than women. So I just pointed out the protective role of testosterone versus the hormonal flux that occurs in women and females every month, which increases our predisposition as women to depression and anxiety. So like Mr. Sam mentioned earlier, it is true that men are 3.5 to 4 times more likely to die by suicide. Not that they attempt suicide as often as women. They just tend to use more lethal means. As we shall go on in this presentation, you will understand why. And this is actually the crux, the fundamental issue that I hope to pass across in this presentation, which we shall discuss going forward. So men are more likely also to have substance use disorders. As we shall go on, I'll explain why, but it has something to do with tendency of men to avoid and not to face their emotions and to look for other ways to handle how they feel. So compared to women, 27.7 million males are more likely to have the substance use disorder, either as a primary disorder, as in that is the only disorder they have, or as a comorbidity, that is having that substance use disorder in addition to another disorder like depression or anxiety. There are so many things that influence the mental health in men, like anyone, like women. But for men, societal expectations, cultural ideas, also family upbringing play a very important role in how men see themselves. So remember when I was defining mental health, I said it had to do with thoughts, emotions, and behavior, and how that behavior affected relationship. So society has recurrently told men how to be men, what it means to be masculine. And unfortunately, these myths coming from society are not helpful at all. Actually, they are detrimental to the mental health of men. Society has also shown men that, you have to be strong all the time. You have to always be in control. You must be the breadwinner. You need to rely on yourself and not seek help from others. You should not speak about emotions or even have them, let alone express them. So we shall come to understand how these societal expectations actually affect the mental well-being of men. So, because society expects a man to bottle up their emotions and not express it and not feel it and be strong and not ask for help, a lot of men tend to avoid their emotions. They tend to not even want to feel it. They tend to deny even that they have emotions. So, this makes men to not be aware of their emotions. A lot of men engage in a lot of distracting activities. Work is key, workaholic. So, work is great, but when it's a distraction to avoid how you really feel about yourself, about other people, your thoughts you have, then it's a problem. So, what happens is that a lot of times mental illness, especially depression, shows itself in anger and aggression because it is more socially acceptable. And men tend to want to externalize and dissociate, meaning take themselves away from the problem, especially when it has to do with negative emotions. Women, on the other hand, tend to internalize. So men, because of societal expectations, amongst other things, tend to deny their emotions, they avoid, and they engage in distractions. Again, because of societal expectation, men cope and handle, deal with unnecessarily so, higher levels of distress than they ought to deal with. And because of that, they tend to suppress how they really feel. And in addition to that, don't seek help when they need to. Because society tells men that they are almost like self-sufficient. They shouldn't ask for help because that means they're weak. Compared to women, generally speaking, men tend to seek help less often than women tend to seek both medical and professional or psychotherapeutic help when they need it than women. So men tend to want to conceal their needs or even deny them, going on, to have high levels of avoidance. And they tend to downplay their symptoms, all in keeping with avoidance. In addition to all this is the stigma, unfortunately, still associated with mental illness, especially in Africa, where people, don't want to be labeled as having mental illness for fear of being seen as weak, as weird, as psychos. And sometimes the stigma is from the men themselves, where they feel like if I seek help, it confirms that I have a problem and it means I'm weaker. So they avoid all that and keep plying on ahead and ignoring their mental well-being. So this shows up in how different mental illnesses, express themselves in men. So depression, I explained earlier the difference between depression and sadness. Generally speaking, where women would cry because it's socially acceptable, women would weep and, vent. A man would typically be withdrawn, angry, irritable, aggressive. Antisocial personality disorder is a type of personality disorder in which the man who has it has a long-term pattern of being manipulative, exploitive, violating the rights of others. This is common in men. Schizophrenia is a type of psychosis. Women and men are equally affected, but this tends to show up more as negative symptoms in men because of genetics and because of genes that are more prevalent in men than women, but also because of social factors and social support, which men sometimes tend to have less of compared to women. Bipolar disorder is another serious type of mental illness. Again, it has equal prevalence, but because of the societal stereotype that are placed on men to be the risk takers, to be the ones who are often drunk, who cope with alcohol, men with manic episodes from bipolar disorder may be misdiagnosed, may be missed. just because of gender stereotype, where it is excused for a man to get drunk and to, engage in drunk driving or risky behaviors, whereas for women, it's not really acceptable. So again, like I said, men tend to avoid more than women. Coupled with everything I've said, coupled with not wanting to seek help, coupled with avoiding emotions, coupled with the tendency to externalize and be aggressive rather than to cry because it's not socially acceptable, all these compound issues for men in terms of mental health. So who is at risk? What kind of man is at risk of having mental illness? Well, research says older white men, because of a variety of reasons, older white men are at higher risk of suicide, especially those who are more than 85 years of age. So many reasons behind this. Some research say loneliness, feeling burdensome, having lost loved ones, and so many other reasons. Men who have experienced trauma in their life are also at an increased risk of mental illness, especially something called post-traumatic stress disorder, PTSD for short. So this occurs in men who have been in combat, especially war veterans, or who have been victims of trauma, maybe not in a war situation. Men who experience employment issues are also at an increased risk of having a mental health issue. From experience, this has a lot to do with the fact that a man identifies his sense of self has a lot to do with the work he does. So a man who loses his employment sees himself as a failure, as not good enough, as not measuring up. Marital breakdown is another risk factor. So men who have experienced divorce are more likely at an increased risk of having depression than men who are still in stable relationship. Again, this is because most men, generally speaking, don't have a very strong social network. So men typically tend to rely on their wives. So when this love relationship, this marital relationship breaks down, it increases the risk of depression in men. Men with legal and financial problems are also at an increased risk of mental illness. This can trigger mental illness. It can also increase the risk of suicide. Key and the hallmark of the risk of suicide being increased is the feeling of hopelessness, that there's nothing they can do to help themselves. Men who use substances are also at an increased risk of mental illness. Again, remember I mentioned earlier that men tend to use substances to cope with their mental health difficulties rather than seek appropriate help, and they tend to avoid, dealing with their emotions because it's not acceptable to feel emotions according to society anyway. And so they're left with substances to cope with their negative and painful, intense emotions. Men with a family history of mental illness are also at an increased risk, and men dealing with life challenges. So it's not a very good idea to ignore your mental health. What are the consequences? Increases the risk of addiction. So if you tend to feel like my physical health is more important, I'm weak if I admit that I have emotions or I express emotions, then unfortunately you stand the risk of, you know, you are at an increased risk of addictions and also of mental health disorders themselves, like depression and anxiety disorders. Types of anxiety disorders include social anxiety disorder, obsessive compulsive disorder, generalized anxiety disorder, and of course, increased substance use, just as a way to cope. Productivity is also affected, and this reduces efficiency and increases absenteeism, sleep problems. So when you're worried about something, maybe you don't have someone to express your emotions to, or you feel you shouldn't express the emotions, then you sleep worried, and then you don't get good sleep, and then work is affected. So it has very cyclical, and domino effect. Again, physical pain is aggravated, medical conditions are aggravated. There is an interrelationship between our physical and our mental health. They are not just equal, but they're interrelated. So what affects you psychologically, emotionally, can also affect you physically because you cannot separate the mental well-being from the physical well-being of a person. Increased stress, as we shall come to understand even more, also affects, the mental health. And it's one of the consequences of ignoring your mental health as men. Increased cardiovascular risk is another consequence. So cardiovascular risk actually is increased by psychosocial issues like mental well-being. Psychosocial issues are minor risk factors for cardiovascular diseases, including heart disease, including stroke. Relationship difficulties are another consequence of ignoring your mental health, all because it's a way of coping. So people find succor in other relationships because maybe they find someone, especially if they're married, talking about the married men, if they find succor in another relationship besides their marital relationship. So this is what increases the risk of infidelity. And when infidelity increases and the marriage relationship is imbalanced, then children may be neglected. At the end of the day, it results in reduced self-esteem of the man. So what can you do? I've talked a lot about mental well-being, about the things that affect your mental well-being as men, about societal expectations, which are unrealistic and false at best. But now I'm going to explain what can be done. So the first step is to dispel the myth, not to accept it. So there was once a time when women, and still today, there's some countries where women are not allowed to work. But once upon a time, women were seen as, you shouldn't educate the girl child, and even in some places in Africa till date. But just the way that is being overcome, the same too about societal expectations of men. So seeking help is not a sign of weakness, it's a sign of wisdom. Real men do have emotions and feelings because they're human like everyone else. Having emotions does not mean you're weak, it means you're human. So when I say dispel the myth, I mean create a safe place within your own self. When you learn to accept your humanity in terms of that I have emotions, and rather than distract myself from these emotions, I will stay with them and ask myself what's going on in my mind, what am I thinking? Speak to myself as I would a dear friend. I'm getting a lot ahead of myself. We'll talk about this more in depth when I talk about stress. But creating a safe place within yourself is the first step. So you as a man need to give yourself permission to be human and realize that being a man does not necessarily mean that you have to take all the responsibilities onto yourself. It does not mean that you're not human. It does not mean that you never need help. No human being is completely 100% strength all the time. Human beings, by definition, are a combination of strength and weakness. So do not also propagate these myths. So we do that inadvertently as parents, in the way we treat our children, in the way we respond when they're present. So your child might fall, it's a boy, don't cry, boys don't cry, be a man, things like that. Things like that are telling the children, sending the message that if you're a man, you don't cry. So we inadvertently propagate these falsehoods by the way we live in front of our children and the things we say. So the way to nip this in the bud is to mind and be careful and pay attention to how you behave in front of your children. So research has shown that as far as children are concerned, male kids tend to see their fathers as the role model of what they should be like when they grow up. So men, you are role models, but this is not to give you, too high an expectation. It's just to make you understand that beyond you, the next generation depends on how you handle these myths. Validate your own emotions. So to validate means to tell yourself that it's understandable, that it makes sense for you to feel however you feel because you're human, because you've had this experience, and being human, you handle it in this way and you have these emotions. So it makes sense to feel this way. So to be able to have that sense of, thinking about yourself means that you have to be self-aware. So when we talk more about stress and how to handle it, I'll expand more on how to be self-aware, how to slow these things down and to be less reactive and more proactive, to be less impulsive and to be more mindful. Mindfulness means being in the present, not only in the present of other people, but in the present with yourself and your own emotions and your own thoughts, and not always seeking to run out and distract yourself from these emotions. Because granted, they are painful, they can be intense, they can be overwhelming, but they have their uses as well. So human emotions help us to understand what's going on inside. They give us information about what's going on inside that if we ignore, would be like you feeling physical pain when you put your hand in the fire and choosing to do nothing about it. Another thing that you can do as men is to recognize the symptoms. So recognize that generally as men, so this is generally speaking, some men can feel sadness when they're depressed and things like that. But generally speaking, if you notice that you're becoming more frustrated, your level of tolerance is reducing, the things you could cope with before, remember the definition of mental health, not only being aware of your own abilities, but in such a way that you can cope with the normal stresses of everyday life. So not the absence of stress, but the ability to handle stress. So if you find that you are less able, different from how you used to be, of handling stress and anger, then you know that, okay, maybe I need to check in with myself. Maybe I need to be self-aware and ask myself, what am I thinking? What is going on inside? Recognize mood changes. Recognize when you're no longer able to concentrate as you used to. Recognize when your energy levels are fluctuating, when you're not as optimal energy wise as you used to be, when you're not as motivated as you used to be, when your appetite changes, when you find that you need to distract yourself more. These are telltale signs that something might be wrong and it's a time to get help. So you can get help from other people. So I put an asterisk on social support because there's a tendency, there's a myth, again, societal myth, that men, are good by themselves. They don't need social support. The women have their girls, the women have their group, their crew, their group. So men need support like everyone else because they're human like everyone else. So get help from your social group if they think they're helpful. Get help spiritually. So spirituality is huge. If you're a spiritual person, there is nothing like leaning on a higher power, a God, if you believe in God. And of course, get help from psychotherapy, from your physician. You might need medications. So we finished the first part of the presentation. Now I'll expand to you what stress is all about. We mentioned stress here and there in the initial part of this presentation because stress can affect mental health, which is why we're having this conversation. So what is stress? A lot of people say, I'm stressed, this is stressful. What is the definition of stress? Stress is a perceived substantial imbalance. So the emphasis is on the word perceived. It's a perception, the way you see it. It's a perceived imbalance between the demand and response capability under conditions in which failure to meet these demands has important, perceived, catastrophic consequences. So in layman's term, stress is how you feel when you feel like what is in front of you is way beyond your ability to meet this demand. And if you don't meet this demand, the consequences are catastrophic. That feeling that you have when something is bigger than you, when you feel like you're not meeting up to expectation, that is stress. So what causes this feeling? A lot of things. Future, your health, family, your home, your relationships, money, security, the economy. The list is endless. But I want you to take home that the causes of stress may be extrinsic from outside, or they may be intrinsic from within. So this is key because a lot of us think stress is something that happens to us. We think this is something, someone has done to us or someone else is responsible for. When actually our personality, unhelpful core beliefs, a core belief is a basic way you see yourself. So from the cognitive behavioral perspective, there are different layers of belief. And the core belief is the fundamental belief, the way you basically see yourself. So if you see yourself as basically not good enough, basically not being able to measure up, then coping strategies like working extra hard, putting in more time, reading that mail over and over again, second guessing yourself might put additional layer of stress beyond what the external factors put on you. So core beliefs, negative, unhelpful core beliefs, which by the way is not your fault if you have any of these, it's as a result of life history, life experiences make us see ourselves the way we see ourselves. So unhelpful core beliefs and personality types are also responsible for an additional layer of stress that we might feel. Internal versus external locus of control. A locus of control is what you believe to be the reason why what is happening in your life is happening in your life. So having an internal locus of control means I believe that I'm basically in control of what is happening. I have choices, I have responsibilities, and the choices I make lead to, certain consequences. I am in control. Whereas having an external locus of control means that you feel like what is happening in your life is beyond your control. So women tend to have more external locus of control, while men have an internal locus of control. So this is good, but can also be unhelpful because a lot of men feel like if things go wrong, I'm responsible. Only me, I need to fix this, which as we shall come to see is not always very helpful. Unhelpful coping strategies. So when you take alcohol to cope with the way you're feeling, the sadness inside and the anxiety you feel, or you drink or use substances to cope with the nerves, then you tend to compound things and add another layer of stress. How does stress show? What are the symptoms? So stress can show up physically in our bodies and also in our minds and how we feel. So physically, stress can show up as a worsening of a medical condition that you already had. So for instance, you had low back pain. Being stressed, because remember I said there is an interrelationship between our physical and our mental well-being. So when you're stressed, physical complaints can become worse. Blood pressure, if you're hypertensive, for instance, your blood pressure could become harder to control even when you're adherent on your medications. Recurrent minor illnesses like malaria for those of us in Africa, upper respiratory tract infections, colds, flus, you'd be at an increased risk of having these just because you're stressed. Stress can affect your sleep. It can affect how your appetite behaves. It can affect how you think about yourself and how you feel about yourself. So low frustration tolerance is a hallmark of stress and also a hallmark of, mental unwellness. Forgetfulness, not being able to concentrate. So this is important because if you catch yourself feeling any of these, you might want to check your level of stress and ask yourself what's going on and be mindful. But we'll talk about that more going forward. The bottom line is that stress is holistic, unfortunately. It affects our bodies, it affects our minds, it affects how we feel, and that affects how we behave. So you can just imagine the consequences this would have. So being stressed and not dealing with it can affect you as an individual, physically, mentally. It can increase susceptibility to minor illnesses, like I mentioned, and even some cancers. We know from research that lung cancer, colorectal cancer, have an increased you have an increased risk of these cancers if you have chronic stress. So long-term stress. So just to point out, stress can be acute or chronic. The negative consequences are not typically associated with acute stress. I'm talking about long-term chronic stress. And this is the reason. So stress by itself is not negative. Neither is it necessarily positive. It's neutral. But if it helps you to deal with short-term challenges, like you have an exam to pass. So that feeling of, oh, I need to meet this expectation because I need this promotion or I need to get to the next level in my career, that can actually galvanize you and increase your motivation so that you achieve that goal. So acute stress is not bad, it's not problematic. But when you have chronic stress, for instance, an ailing relationship, for instance, an ill child, something that makes you constantly feel this discrepancy between your ability and your personal ability and the demands placed upon you, that is when we have the consequences I'm talking about. So increased risk of medical problems, heart disease, stroke, obesity, like I mentioned earlier. Stress is a minor psychosocial risk factor for cardiovascular disease. So what are we going to do? How do you as men promote your well-being? How do you handle this stress? Number one is to be self-aware. You will not be able to cope with something if you don't even admit that it exists. So I recommend self-awareness, self-examination. So I tell my clients all the time that it's always a good idea to spend at least 30 minutes by yourself, just going through how your day has been, asking yourself, what am I thinking? How am I feeling? What has happened? And if you need to let something go, that is the time. If you need to identify whether this is external or internal stress, this is the time. If you need to forgive yourself or other people, that is the time. And this, importantly, will help you to be able to identify whether the source of this stress, once you've had time to think about it, is something within your control or something not within your control. So, just to point out, a lot of men and women, if I might add, try to exercise control over something that is not within your power to control. For instance, we try to control what people think about us. But the truth is that people will think what they think regardless of what you do. There's nothing wrong with, putting your best foot forward. But when you are inappropriately consumed and preoccupied with how people see you, that is something that is not within your control. Another thing that is not within your control is something that starts with what if. So, what if no one is listening to me? What if you find this presentation boring? This is a kind of thing that is not within my control. So I'm trying to explain to you the difference between what you can control and what you cannot control. Something within your influence and something not within your influence. So if it is within your influence, whatever the source of stress is, then you'd want to use a problem-focused coping strategy. If it's not within your control, there's nothing you can do about it. There's nothing someone that knows someone that can do anything about it, then you have to use an emotion-focused coping strategy. Emotion-focused coping strategy. So many things you can do to help yourself handle stress. And I want to add that this is also extremely helpful for handling your mental well-being generally. I would have mentioned it earlier, but I didn't want to repeat myself. So regular self-care. Now, this sounds like something a woman would do, but men, this is something for you as well. Prioritize yourself. So we appreciate you as men and your contributions. You are our brothers or fathers or friends, but if you don't prioritize yourself, if you've been in an aircraft before, they typically say wear your own mask before helping others. Yes. So if you don't prioritize yourself, very soon you will not be able to give what you used to give because you will not have it to give. So when I say prioritize yourself, I mean your physical, emotional, psychological well-being. So bottom line, I'm talking about self-soothing. So to self-soothe means to use your five senses, your sense of sight, your sense of hearing, your sense of touch, your sense of smell, your sense of taste in the service of helping yourself however you want to help yourself. For instance, you feel stressed, it's been a long day at work, the boss was unreasonable, made unnecessary demands, and you are anxious, you're angry. So self-soothing would be like, what will I look at that would make me feel better? So for some people, it would be the picture of a loved one. It could be a nature scene. It could be anything that makes you calm and makes you feel less anxious. Then you could use your sense of hearing. What could you hear that would make you feel less anxious, less angry? For some people, it could be a motivational podcast. It could be the voice of someone you care about. It could be soothing music. It could be, spiritual or scriptural messages. Then what could I feel that make me feel better? So this is using your sense of touch. So a lot of us feel that we have to have someone hug us, right? You're waiting for someone to hug you and help you feel better. Newsflash, you can hug yourself. You can soothe yourself. You can tell yourself, speak to yourself kindly the way you speak to someone you care about. That's self-soothing using the sense of touch. If you don't want to touch yourself and comfort yourself by giving yourself a hug, you can touch something that suits you. So for some people, the feel of warm water on their skin or the feel of holding a warm cup of coffee or a mug of tea, even the smell, I might add. So you can double up the senses. You don't have to use one at a time. All these are soothing. So we've been talking about self-soothing when you're prioritizing yourself as part of regular self-care. Self-compassion is huge. So human beings, generally speaking, men and women alike, we tend to be our own worst critic. So the world is knocking you out and then you join the world and knock yourself out. So how about being your own cheerleader instead? So we all have an inner critic. How about turning that inner critic into an inner fan? So self-compassion doesn't mean, letting yourself off the hook. Because I've heard people say, well, I did that poorly. I can't just let myself off the hook. I deserve the blame. I'm not talking about letting yourself off the hook. I am saying, even if you did make a mistake in that presentation, for instance, even if you did mess up that pitch, I'm saying Talk to yourself the way you would a dear friend. So if a dear friend messed up, you'd probably say, yeah, you didn't do so well, but, what could you do to make it better? Maybe you could re-strategize to make it better. So that's what I mean. So self-compassion means talk to yourself the way you would a dear friend and ask yourself, what do I need? And give yourself what you need. So you can give yourself what you need by way of self-soothing, or you can give yourself what you need by way of giving yourself a treat. Take yourself out. So self-awareness versus avoidance. Avoidance is when you run away from how you feel. Self-awareness is when you sit and ask yourself, what am I feeling? So express yourself. Contrary to societal expectations and cultural ideas, it is okay for a man to express how he feels. So expression doesn't necessarily always have to be by disclosure. You can paint, you can draw, you can sculpt if that's what you like to do. You can cook if you want to do that. It's a way of letting out whatever you feel inside. Some people like to play sports. I think that's a man thing. I hope I stand to be corrected. Spirituality is another way you can deal with your emotions. Prayer is another kind of mindfulness practice where you focus your mind instead on a higher being. Meditation is where you think about something, bring your awareness to the thing that you're thinking about, stay with it, describe it, fully immerse yourself in it in, in a way that is effective, which means doing what works. Deep breathing is is a technique I love, the 4-7-8. So it means take a deep breath while you're counting to 4 in your mind, hold it while you're counting to 7, and exhale while you're counting to 8. Visualization means to have a mental picture of yourself coping with whatever it is you're dealing with. Mindfulness means to be in the present. So a lot of times our worries and our stress want to drive us into the past where we ruminate and go over and over again over what we did wrong and how terrible we did. So to be mindful means to disengage from that and be in the present. So you can be in the present by grounding yourself. And to ground yourself means to use your 5 senses to describe what's going on around you. So mindfulness is huge, but because I don't have so much time, I need to move on. So it's a way to extricate yourself from the future and from the past and to be in the present. We know from research that doing this reduces the intensity of emotion you feel. Distraction is huge, where it could be sports, it could be talking to someone, it could be going out, it could be any of your 5 senses. But I want to point out that this is best if it's temporary. If you distract to get away from all your emotions and never sit and deal with it, then that becomes a problem. Sometimes communication is a source of our stress, where instead of being assertive, where you say what you feel without infringing on the rights of the person listening to you, instead of being assertive in that way, we are either passive, where you're like a doormat and have people infringe on your own rights, or you're aggressive where you infringe on the rights of other people. So assertiveness is to be in the middle. If the problem is something within your control, then you want to use a problem-oriented coping. You want to problem solve. You want to check your time management. You want to see if there's some kind of support you can get from outside, like to outsource. I want to just point out some hopeful coping strategies, just so you have that in mind. So to eat more. So I know I talked about self-soothing using the 5 senses, including taste. But if this is always your go-to strategy and you don't use any other thing, you stand the risk of increasing your own risk of having an eating disorder and gaining weight, I might add, and increasing your risk of hypertension and all the other cardiovascular problems. So unhelpful coping strategies are substances. Catastrophizing means to think the worst. Non-disclosure is to hold it in. Infidelity, unhelpful relationships. So another way to handle stress is to look at what you're thinking. So because I'm a cognitive behavioral therapist, there's something called the cognitive model, which basically means that we are affected not necessarily by the situation per se, but by the meaning or the interpretation we give to situations. In other words, to the thoughts we have about the situation. So if you are self-aware and you take my advice and you spend some time by yourself and you realize that you have thoughts like, my boss is crazy, my boss is unreasonable, for instance, or I am not good enough, then rather than accept your thoughts, hook, line, and sinker, you can actually question these thoughts by using some questions. And I use the acronym FAST. So F could be What's the evidence in favor or against this thing I'm thinking? What's the evidence to say that I am not good enough, or actually I made a mistake and I'm like everybody else? Is there another way to look at it? That's the A. So what if it's true? What is the worst that could happen if I did poorly in that presentation? What's the worst that can happen? And okay, how could I prevent this from happening? What's the best that could happen? And how can I make this more likely? What's the toll? That's the T. So using fast questions to question your own thoughts, in that way, question your perceptions, could help you realize that sometimes your perception is negatively skewed and maybe might be an over exaggeration or a maximization of what actually is and not exactly a fact. So there are other ways to handle stress. You could, you know, help to achieve a work-life balance, and in that way handle stress. And also, I might add, maintain good mental health. Maintaining a healthy lifestyle is huge because remember that physical health has an impact on mental health. So if you're physically active and healthy, then there's an increased likelihood that mentally you'll be lively and healthy as well. Communication skills. So this is for those who tend to be either passive or aggressive and not assertive. So to achieve a work-life balance means rather than have your whole life in your work, like you have no other passions and no other hobbies and any other things that are important to you, only your work. If you want to achieve a work-life balance, you need to compartmentalize. And what I mean by compartmentalize is to find other things that are important to you, other things that are you're passionate about, and find, identify your goals about these things and identify behaviors that would help you achieve this goal. So being able to do that would help you to flesh out other important areas of your life such that if work is not going too well, it would not affect you entirely. So identify your values, things you're passionate about, the things that really matter to you. What are the goals? What are the things you want to achieve in these areas of your life? It could be friendship, it could be family, it could be fun and adventure, leisure, sports, volunteerism, spirituality. And when you identify the goals and find out what behaviors would help you achieve this goal, in this way, you are making your life fuller and you are achieving a balance so that your life is not completely only about maintaining a healthy lifestyle means taking care of your physical health. So taking care of your physical health is one way to ensure and reduce vulnerability to having your mental health suffer. So when I say maintain a healthy lifestyle, I'm talking about exercise, diet, sleeping well, taking in water, and avoiding substances. So general advices, I'm sure you all already know, for exercise, it's not good for human beings to be seated for too long. So if weight loss is a goal, you need to be physically active for about 1 hour in 24 hours. And you need to be engaging in some kind of aerobic activity, which is any activity that makes your heart beat fast. So please be sure to check off with your physician before engaging in any kind of exercise regimen. Exercise is not only aerobic activity, it's only if you want to do weight loss that would be the major focus. But we have strengthening exercises, we have flexibility exercises, we have exercise for balance. So basically being physical active, even if weight loss is not your goal, increases your physical health, and in so doing increases your psychological, your mental health. Diet is huge. So what you eat, essentially you are what you eat. So the plate on the side is an idea, an example of how we all ought to be eating, regardless of whether you have any underlying mental medical condition or not. So if you were to divide your plate into four, one whole half would be vegetables and fruit. The other quarter would be carbohydrates, preferably complex carbohydrate like beans, like oats, like lentil, for instance. And the remaining one quarter would be protein. Best if you can manage white meat versus red meat. Adequate sleep is important. As adults, it's great if you could have at least 6 hours of sleep. Anything less than that, less than five, you'll be increasing your risk of physical, problems. Water intake. So it's great to drink at least 2 to 3 liters of water per day and avoid substances like cocaine, weed, cigarettes, alcohol. So these are ways we can increase our physical health, reduce our stress, and increase our mental well-being. It's also good to increase our bank of positive emotions. So negative emotions are always there, always at us from all sorts of places. So, but we have the ability to also accumulate positive emotions. So the A, this is an acronym, ABC, from dialectical behavior therapy. So accumulate positive emotions means to schedule short-term and long-term things that give you pleasure, essentially schedule for yourself. So we schedule appointments, we schedule meetings. So I'm suggesting that you schedule pleasure as well. In that way, you increase your bank of positive emotions and you have a store. So when negative events come, you are less likely to be submerged or overwhelmed. So to build a sense of mastery means to increase your sense of achievement. So do something that gives you the sense that you have achieved something, sense of achievement, like increase personal development, get an additional degree perhaps, increase, intellectual in the intellectual sense. Whatever would increase your sense of achievement is what we mean by building that sense of mastery. The C stands for coping ahead. It means basically that rather than have an upcoming negative event and just, anticipate and be anxious, you can actually cope ahead. You can imagine this difficult situation, imagine all the things that could go wrong, and then you can go ahead to plan and strategize on coping with these things that could go wrong in such a way that you go in your mind, you rehearse. Another word for it is covert rehearsal. You will rehearse ahead of time how you would handle difficulties that come along in such a way that you are already used to this before the actual event happens. So to do this, you can cope. Pair this with visualization. Pair this also with 478 breathing if you like. Bottom line is that this would help you to cope in difficult situations. Communication. So I mentioned that one of the things that increases our feeling of stress, that something is beyond us, is our inability to communicate effectively. So if you're passive mostly in your communication or aggressive mostly in your communication, these steps I'm about to teach you will help you to be more assertive, where you say what you want to say without needing to attack anyone else or being attacked yourself. So the acronym is IDEA. I stands for icebreaker, where you say something to diffuse the tension, if you like. So you say something, state the emotion you see, and then summarize what you hear. So it could sound something like, I can see you're angry, and I understand, given that I did come late for the meeting. So that's like an example of an icebreaker. And then if you want to apologize, that would be a good time as well. The D means describe the situation. So this is important because we tend to generalize things and we tend when we're describing to going with the emotions, but the D stands for describe just the situations without expressing your opinion or judging that situation. So in the example I gave, describe a situation might look something like, so there was traffic at work. I realized I had a meeting and I probably should have left home on time. And that's it. That's describing the situation. Then the E stands for expressing how that makes you feel. This is actually best in interpersonal relationships when you're having a conversation with someone close to you, someone you love. It can be adapted to suit workplace, but it was originally intended for that. So the E is where you say how what happened makes you feel. So from experience, I've found that men more than women generally find it difficult to actually name what they feel. Perhaps because of what we mentioned earlier about avoidance and, all the societal misconceptions. But basically, the E means just say what you feel, starting using the word I, not you, because that would be more accusatory. So in the example I've been using, you'd say something like, you know, I, it's understandable why you're angry, and I feel I'm sorry, or I feel, I feel, I feel bad that I made you go through what you went through, something like that. Then the A is where you say exactly what you want, where you're specific, like, where you say something like, for example, perhaps in the future, I will give you a heads up or make a phone call ahead of time, something like that. So the IDEA acronym is an acronym for you to remember how the steps you need to take to help you to be more assertive. So in conclusion, I've been talking about stress. Stress is universal. Nobody is exempt from stress, including children, men, women, and children. It could be acute or chronic, but the chronic stress, especially when it comes to the workplace, talking about men, is detrimental to your physical health and mental health. So using the techniques I mentioned, emotional coping techniques, problem solving techniques, trying to compartmentalize your life, trying to look after your physical health, trying to increase your bank of positive emotions, all these things can help you handle your mental well-being and reduce your stress. Thank you.